This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about one of the most overused surgeries in all of orthopedics. If you like this video, we put out new content weekly, so please like and subscribe. So in my opinion, one of the most overused surgeries in all of orthopedics is your ACL reconstruction. And I know you've probably seen professional athletes, they tear their ACL, they're out for a season, they get it reconstructed, and then they're back as good as ever next year, and that's true. And before the modern surgery of reconstructing ACLs, that was a career-ending injury. So I'm not trying to say it's a bad surgery and it doesn't help a lot of people, because it does. So there's kind of people who benefit from an ACL surgery and certainly need it, and then there's a basket of people who probably never needed it in the first place. So let me talk about that. So the people who need it are the people like the professional athletes or people involved in sports where they tear their ACL and after they can't play their sport anymore because their knee's not stable. Whether you're 17 years old or playing soccer, or you're 42 and you can't play volleyball anymore, same sort of thing. So after you tear your ACL, if you're someone that, like a professional athlete or high-level athlete, of course, but who finds that you can't do the activities you want to do because your knee doesn't feel right, it doesn't feel stable, then that's who does well with an ACL reconstruction. So how about who really probably doesn't need it? So if you're older and you're not doing those activities, there's a good chance that after you tear your ACL, you can get to a painless, stable knee without ever doing surgery, just by doing physical therapy and rehabilitation. So in that case, what does reconstructing the ACL really do? Well, we used to think that it would help prevent arthritis later on, right? We're restoring the mechanics of the knee and will prevent arthritis, but it doesn't really do that, it turns out, after studies have shown. So whether you tear your ACL or, and whether you get it reconstructed or you don't, it seems like eventually, you develop knee arthritis and need a knee replacement anyways. But there's a lot of people walking around who don't even know they have ACL tears, and you only find out about it after you get an MRI for some other reason. So they've obviously torn their ACL in the past and basically got to a point where it wasn't bothering them until something else happened. But if people like that go into see a doc who does ACLs, and look, these people love to do ACLs, orthopedic sports docs, they're going to tell them they need an ACL reconstruction because it's missing and they can put a new one in. And those are the people I think who really don't need it, because now not only you've bought yourself surgery with potential complications, you bought yourself a tremendous amount of post-operative physical therapy when you might have been able to just do physical therapy in the beginning and never need the surgery in the first place. Of course, most of them are probably not going to tell you that. But I've seen it happen before where they find that and someone's in their 50s or even in their 60s with knee arthritis, they're getting ACL reconstructions, and then a couple years later they're getting knee replacements. And guess what they do in the knee replacement? They cut out the ACL. So it's all for naught. So those, it seems to be overused essentially in that population. And look, let's be honest here. If you're a hammer, everything looks like a nail. If you're a guy who reconstructs ACLs, or gal I should say, all the time, and you see one missing, you're going to think that there's a high probability that if you see that doc, they're going to tell you need a new ACL, even when you don't. And they're very persuasive. I've had patients before where I'm like, do the therapy first, see how you do. If you still need it afterwards, then you can get it, and they'll still end up at somewhere else and they'll end up getting it done. So that's basically my 2 cents on it. I think it's a good surgery. It really helps a lot of people get back to sports, but there's a whole subset of the population who essentially is probably getting no benefit from it, and it's just they're going through surgery and a tremendous amount of rehabilitation, really unnecessarily. So that's my 2 cents about it, what I think is the most overused surgery in all of orthopedics. If you like this video, we put out new content weekly, so please like and subscribe. If you have any questions that I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond. But just note that I can't give you any specific medical advice because this video and all my videos are for educational purposes only. Thanks for watching.